Well, hello, everybody, and welcome. Welcome to the London Global Cancer Week and our session on cancer control in the face of climate change. My name is Joan Schiller, and I am the co-founder and current director of a group with a very unusual name called OUCH. Sarah, can you raise the slides for me?
Yeah, one moment. Can you see now?
Yes, that's perfect. Yeah. So yes, so we are the group with the unusual name, which stands for Oncology Advocates United for Climate and Health. And there's our QR code. And next slide. And what are we? Who are we? Why did we form this group? Why involve oncologists and oncology advocates? And that's because cancer is a very scary word, and it touches everybody. And we know that as oncology professionals, we are trusted messengers. And we wanted to get the message out that climate change affects cancer care, cancer outcomes, and cancer incidence. Next slide. So our mission is to advance awareness, actions, and policies that mitigate the effects of climate change on human health, cancer incidence, and outcomes. And we do that by educating our peers, our policymakers, our advocates. We advocate for policies that for sustainable healthcare, and we promote actionable steps in climate mitigation, advocacy, and research. And next slide. And I'm bringing this slide back up to give you a chance to get a picture of that QR code and hopefully join our group, which you can do online. Thank you, Sarah. Okay. So I would like to start out by introducing our panelists. Professor Renzo Ginto is an associate professor of global and planetary health at SingHealth Duke NUS Global Health Institute at the Duke NUS Medical School of the National University of Singapore. He is also a member of the National Panel of Technical Experts of the Philippine Climate Change Commission, World Health Organization's Technology Advisory Group on Ethics of Climate and Health, and is on the editorial board of the Lancet Planetary Health and Lancet Commission on Sustainable Healthcare. So welcome, Renzo. Diana Van Vliet is director of the nationwide clean air advocacy for the American Lung Association, where she works to advance federal clean air and climate productions. She is former manager of policy communications at Climate Nexus, a nonprofit communication organization focusing on climate and clean energy solutions. Thank you for being here, Diana. Ellie Darkin is Director of Global Partnerships and Stakeholder Relations at AstraZeneca. As part of her role, she builds public-private partnerships that advance solutions to the critical challenges we face here in the fields of climate, health systems resiliency, and health equity. And Dr. Omar Abdi Hamid is a Common Sense Oncology Research Fellow in Cancer Care and Epidemiology at Queen's University in Kingston, Canada, and a clinical oncology consultant at Garissa Cancer Center in Kenya. So again, welcome to you both. And our moderator today is Dr. Sarah Briggs, who is a clinical lecturer in medical oncology at the University of Oxford, who is researching sustainability in healthcare, and I'm proud to say a member of OUCH. Take it away, Sarah.
Thanks so much, Joan. So thank you all so much for joining us today. The plan was to have a fairly informal discussion around a range of issues integrating climate change and cancer control. So we had some submissions questions from people who signed up, which we have. I have a list of, but if anybody else wants to chip in as we're going along, please do feel free to put your hand up or voice a question. I'm going to get started with asking each of the panelists really what they see as the key challenges that climate change poses to cancer control. And if we start just going through my screen, Omar, are you happy to take that question first, and then we'll go through people?
Yeah, thank you, Sarah, and the whole Ouch team. Joanne, I should confirm also that I'm a member of, I may not be an active member, but I hope to submit my subscriptions if there is any to be an active member of Ouch. Yeah, so thank you for having me. I think the challenges for climate change is as complex as climate change topic itself, right? But when we try to join that at the hip of even cancer care, it even becomes really difficult. I mean, we keep caring for our patients, but I think it's also time we care for our planet, isn't it? Probably not with the same rigor as a cancer patient's care. But again, I think the challenges, I think, is multidimensional. One is the awareness and education of even the links between these two. The lack of curriculum or even teaching modalities for how intimate, close these two topics are. And I think the general lag or disinterest or even a lot of misinformation surrounding this whole hot topic of climate change really makes it part of the challenges as to why it's probably not popular.
Apologies, Diana, could we go to you next?
Sure. Well, again, thanks to Joan for introducing us to Sarah, and thank you so much for putting this panel on and inviting me. So I'm not an oncologist or a physician. I'm a public health advocate, and so to answer this question, I guess I'd take it a step back and just look at the ways that climate change is impacting health. And at the Lung Association, we of course focus specifically on the lungs, but obviously climate change harms all systems of the body. And we primarily focus on climate through the lens of how it worsens air quality and increases air pollution. So we know that climate change makes wildfires more frequent and intense, and makes wildfire season really year-round now. It's not even a season. And we know that smoke from wildfires contains particle pollution, which causes lung cancer. We also know that climate change makes ground level ozone pollution or smog more prevalent, because it's more likely to form in hot, stagnant temperatures in air. And then we also know that air pollution, climate change increases air pollution following flooding events. It impacts indoor air quality. It increases mold and mildew, which harms health as well. So, to answer the key challenges posed by climate change to achieving effective cancer control, I think the fact that climate change is harming health and increasing cancer through particle pollution from wildfire smoke, and also climate change is making cancer harder to treat. Rising heat and extreme weather impacts patients and hospital systems and disrupts care to patients when these events occur at more frequent and intense intervals.
Yeah, thank you so much. Renzo, what are your thoughts on this starter question?
Sure. Well, thanks for having me. It's good morning from here in Singapore. It's all 1 o'clock. And this is a conversation that I cannot say no to. First, we're having COP29 now in Azerbaijan. And while we are not there, we should continue the conversations outside of the climate negotiations. And it's great that we have the cancer community having this important convening. And cancer, of course, is an important and remains to be an important public health problem. In fact, we are expecting it to continue to grow in the coming years, both in high-income countries, but also in low-middle-income countries. as climate change continues to worsen, unfortunately, as a result of the slow pace of action, of governments, of many different actors when it comes to decarbonization. So I'm seeing here at least two, but I'm sure there are more, parallel crises of cancer and climate change worsening at the same time, perhaps in the same pace. And these two crises, and again, perhaps with the others, will continue to interact and worsen each other and reinforce. And so I think it's important that the climate and health community and the cancer control community are working side by side and even in synergy, right? And I hope that this conversation is just the very start. Because climate change, as already alluded to by our earlier colleagues, will one affect cancer directly, and it's the same principle when it comes to all other health arenas, but it also will disrupt health service delivery. As we speak now, another cyclone is country. I'm now based in Singapore, but I come from a region, Southeast Asia, which is highly vulnerable to climate impacts from the wet phenomena of cyclones and floods and sea level rise, but also all the way to the hot and dry phenomena, heat waves. Asia just had a very serious and unprecedented heat wave season early this year. We anticipate more of that to happen each year. And also drought, and this leads me to the other important effect of climate change. Climate change also will affect the social and the environmental determinants that shape human health outcomes. So that's the indirect way by which it will affect cancer care. The nutritional status of patients living with cancer, especially in underprivileged areas and places, can be worsened if food insecurity also worsens, again, as a result of cyclones destroying farmlands, or our fisheries being gravely affected because of ocean warming and sea level rise. And then, of course, ultimately, climate change will exacerbate existing and persistent inequalities in health. And I think it will also happen in the area of cancer. We already are fighting inequalities in cancer outcomes, in cancer care access, and climate change can exacerbate that situation because of the different pathways that I mentioned, through its impact on the health system, through its impact on the social and environmental determinants. So I think that's a snapshot of what we are not only anticipating, what we are already seeing, and we as the climate and cancer communities should prepare for these challenges and should work together on finding solutions. Thanks.
Thank you, it's fantastic. And Ellie, what was your perspective? I know you're doing a lot of work in various different locations at the moment.
Thank you, Sarah, and thank you both to Sarah and Joan for organising this panel and for inviting myself and AstraZeneca as the kind of private sector voice here. I actually think, Joan, you covered it very nicely at the beginning when you said it's impacting incidence, outcomes, and care. And I think Renzo covered that nicely, talking about the direct and the indirect impacts, because I think you're right, this is a very complex space. And I think one way to look at it is the direct impact that climate change is having on health and on oncology, spurring the burden of lung cancer, for instance, through increased air pollution, but also the impact that extreme weather events, disruptions to energy supply, flooding, all of these climate-related natural disasters are having on the ability to access and deliver routine care. And we see that this is very much a problem across the world, but the heaviest burden is again falling on some of the lower resource populations and those that are more vulnerable in the first place. I actually saw today, somewhat ironically, that we're in the midst of COP and so forth, that the worst ever air pollution reading was just recorded in Pakistan today. And that showed that the air quality index reading was 1,900, and all readings supposedly over 300 are considered hazardous. So if we're looking at kind of the effects here and now of climate on people's health,
it's stark, it's getting starker, and it's often impacting those that are sort of least able to provide care in the face of it. So I don't want to repeat what's already been said, but I would just say that I think what the compounding impact of these direct and these indirect effects, what we're seeing at a macro level is that they're all putting health systems that are already very overstretched under further pressure. They were under pressure when they went into the COVID-19 pandemic. They were under greater pressure when they came out of it. And many of them now are facing sort of cost containment measures and lack of resourcing and funding and political momentum behind healthcare. So I think this is one of the kind of political issues that we see facing this crisis, is that there's simply not the will and the resourcing right now to put in behind healthcare efforts because of the recent history that we've just gone through with the pandemic. So I'll stop there.
Thank you. Yeah, I think that's a really interesting point. The sort of context that countries are trying to work in now are really compounded by lots of different competing challenges and pressures on the health system, which we'll come back to in a little bit. Just going to flag for people who joined perhaps just after we started the discussion that this is a very interactive session. If you've got a question for the speakers at all, feel free to pop it in the chat or raise your hand, and very happy to address things as we go through. I was going to start by just drawing a little bit on thinking about those wider the sort of inequalities and the issue with potentially exacerbating those. I know, Omar, we spoke previously about the setting where you are and working with, having to provide care for particularly disadvantaged communities and the impact that was having. I wondered if you could just give us a picture of what things are like where you're working at the moment in terms of how climate's impacting your populations.
Yeah, I think the intersection between climate health and cancer care specifically really is very palpable in your geographical inequalities, as Renzo has mentioned. There are some areas that really has nothing to do with the raging, atmospheric pressures and global climate change. They haven't contributed a single problem of that, but they bear the biggest brunt, and those are mostly low and middle income countries, which, by the way, have a cleaner air. There's no fossil fuels running up in the air. There's no much chimneys going around with industrialization and all that. But you could say, it's the other side of the coin. There are the communities that are really, are affected by climate change because of the mistakes by maybe high income countries and all that. The global chain is affected once high income countries keep on exceeding the carbon footprints and whatnot. So bringing closer to where I work in my setting, they are some form of climate change is mostly of extreme weather conditions. Luckily, we do not have earthquakes and hurricanes and all that. But at least what we have in northern part of Kenya is extreme, dry spells, so lack of rain, or when the rain comes, really becoming really devastating levels of flooding that cut off, an extremely important road networks to cancer centers. Like the region that I work in, is enjoying for the first time in 60 years a regional cancer center which is fully fledged, has got a radiotherapy machine, chemo. It's got 2 oncologists, serves close to around 700,000 and communities around that area. But recently we had an episode where, following the long dry spell of lack of rain, and then when the rains come, the roads really cut off really bad, and the patients could not even actually come, from neighboring areas to the center. Some of them we had to really, tailor our care for them. When they come, we know they might not come back. So now you see, we have to really adjust how we do things in terms of the care. The other aspect of the community real world experience of cancer care in the face of extreme climatic conditions is these patients are really pushed farther and farther away in search of greener pastures and water. For example, if you are serving a nomadic community in rural part of Africa or even around the world, those people really follow a unique pattern in terms of water points and grazing points. And those 2 points are not necessarily near or are not situated in a bigger, towns that have cancer centers. So they might actually deprioritize their cancer health or even early detection, diagnosis, treatment, follow-up by further going away in search of pasture and water, which is important to them. And again, because of the climatic conditions. So these are some of the real world, and pictures that we really deal with. And I think we cannot continue to ignore the perils of climate change, even if we're not experts per se. As I've mentioned, this is never taught in med school. It's never taught in any of it's just picking personal interest and really seeing what the world is going through currently.
Thank you. And I wondered if any of you have experience of, in light of that, and your comment just now, Emma, absolutely hits the nail on the head, that this isn't necessarily that people planning cancer care are thinking about and familiar with, prospectively, and how do we, does anyone have examples of where that is being done well, either within cancer care or in health systems elsewhere? How do we make sure that those conversations are happening prospectively in terms of how we build healthcare? Renzo.
Yep. Well, if you remember, I started by acknowledging this initiative from the cancer care community. You now have OUCH, and I'll certainly spread the word about OUCH to oncologists, but also to anyone, right? To all health professionals, especially in where I am right now in this part of the world. And actually, based on my experience, so one, this is my first ever conversation or engagement with the cancer community. It's how do I say this? Other specialties, for example, have already begun thinking about climate change, how to integrate it into their work. I remember, I spoke several times to the HIV/AIDS community. I already have spoken a lot, with the mental health community, and the nexus of climate and mental health has been growing, the agenda around it. And so it's never too late, and it's great that we're having this conversation, and we need to make this a truly global movement. And the cancer care movement is a global movement that has a huge untapped potential to be an important voice and an additional voice to the climate and health discourse. And we need to be in COP30, we need to be in all these negotiations, but also we need to be in the national conversations and policy discourses, because that's where the action really will happen at the country level. In the States, for example, and I know it's challenging times for our friends in the US, for Diana, maybe you have some thoughts on that, but it's also challenging in all our settings, right? In Africa, in Asia. And so because it's challenging at the national, we need global solidarity. We need to keep on exchanging, good practices. What works in your setting? Can we borrow those strategies and tactics in trying to put this in the national, both the health agenda, because usually national health policy is not elaborating, for example, on the climate aspect, and even the national cancer policy of the country. Maybe that's something we can do together, review all the national cancer policies and plans and see how climate change is embedded. But also in the climate policy of the nation, of the country, right? Is health in general and cancer in particular even mentioned in the national adaptation plans? I also just want to end this remark by linking it to what Omar just said about this not being part of the curriculum. And I think we need to really work with, our medical societies, including our oncological societies and associations, but also with medical schools and also all health professional schools. This is not just the business of physicians, right? And I'm a physician, I believe some of you as well. But all health professionals should be involved in this movement. And how do we integrate that in the curriculum, it's easier said than done because the curriculum is already very packed, right? With all the clinical content and all the different topics. And how do we embed climate in the cancer module? And of course, it's not a monolithic cancer module. There's so many different cancers discussed in every specialty. How do we do that? I think it's challenging, but it's also a great opportunity for collaboration.
Yeah, I totally agree there. And collaboration, I think we'll come back to that. Joan, you had your hand up. Do you want to?
I did. And then I just kind of wanted to continue along that train of thought, collaboration. And I wanted to ask Ellie, how do you see a public-private partnership working and helping with this issue?
Thanks, Joan, for the question. Yeah, I mean, I think public-private partnerships have a huge role to play in stepping up and addressing some of the gaps and the challenges around the impact of climate change on health. I was actually just thinking when Dr. Omar was talking about the problem of people moving further and further away from care because of the climate crisis and not being able to access cancer care. You know, one of the public-private partnerships we have at AstraZeneca is partnering with governments around the world, but also with an AI health tech startup that's based in India called Cure.ai, which basically has a kind of technological tool, a form of AI that can be used to overlay traditional routine chest x-rays to identify malignant lung nodules, which could be indicative of early stage lung cancer. So because this tool can go on chest x-rays, which can be traditionally delivered in primary care settings, and it can be more easily done in routine care, you can actually help to bring cancer care and early detection to the communities, to the places where people are, without creating necessarily these isolated areas which are getting further and further away from the patients. So this partnership with Cure.ai started as something that we piloted and we trialed just in one country, and now I think we're active in this partnership, always in line with Ministry of Health priorities and national health bodies endorsements, to go to the sites where they are, telling us that they need the gaps. And the partnership's expanded, and we're now active in over 20 countries, and we have this target to reach, 5 million people by next year, which we're more than on track to do. So that's just one example of how, when we work together and we identify scalable solutions, multiple actors and stakeholders can get together and look at what's working, what novel technologies might not necessarily be adopted immediately into the health system, but need a bit more piloting, need a bit more of an evidence case behind them. And that's where I think the role of public-private partnerships is so key in kind of de-risking those novel technologies and those different moves for health systems, and helping to scale them with that strong evidence base behind them. That means that they might ultimately, get financed and become available via national policy.
Lee, I have a follow-up question, and that is AstraZeneca is, of course, a pharmaceutical company. So how did a pharmaceutical company get so involved in this?
Yeah, well, I think actually as a pharmaceutical company and as a company with huge strengths in oncology, we are very acutely aware that we're on the cusps of so many breakthroughs in medicine and so many promising treatments, but they, simply won't be getting to patients unless those patients are diagnosed, detected, treated, educated about their illness, able to follow up with medics and so forth. So, I think it's not really good enough, and it's not really, a way for our business to operate to simply say we provide the medicines and the health system can kind of get on with the rest of it. We don't see that as a sustainable model for healthcare. We see us as very much being partners to the healthcare system, and where there are gaps in certain areas, particularly around education awareness, early detection, access to diagnostics, we do in some countries help and partner and step into those gaps. Because I think, again, to take it back to COVID, that was no better real example when you say, right, we might have had some vaccines available, we might have had some solutions at the table, but the healthcare system isn't there to provide services. Those treatments won't be reaching people, and I really do see that being the same beyond vaccines, to cancer therapies, to new modalities that are coming into the market. That we have a role to play in making sure the health system is able to serve the patients.
Thank you. That's really interesting. Diana, we were talking we've spoken previously about the need for multiple different sectors, so private, public, advocacy from institutions such as yourselves previously. What are your reflections on the role of all the different players in trying to drive forward sort of sustainable cancer care and sustainable policy to protect people?
Yeah, it's, I feel like I am just sort of, this almost feels like I've heard it so many times, but this is an unprecedented issue, and it really requires unprecedented levels of engagement from everyone, internationally, nationally, state, local, private, public, everyone, to avoid the worst impacts. And the American Lung Association convenes a coalition of national health and medical organizations, of which OUCH is a part, that has been going for over a decade. And it involves, Renzo, like you were saying, not just physicians, it's public health workers, it's nurses, but, across not just types of health and medical workers, but also focuses. So, obviously with the lungs represented, we have pediatricians, obstetricians and gynecologists, a number of focuses all come together to advocate for federal policy changes. And we have found that, especially in the United States, not publicly partnering with the environmental community, although we work with them and we really appreciate them as partners, but staying strong in the health and medical voices that we bring to the table has really helped get the message across. I mean, as I've heard multiple folks say here, the health community are incredibly important, trusted messengers. And I think it's so effective. When you talk about climate change, I think most people tune out here in the United States. There's a lot of issues and it's not top of mind. But when you talk about how it's impacting their health, it really does sink in. And I think that, in the US too, people care about clean air and clean water. Trump has talked about how he is promising clean air and clean water. And I think the stakes are higher for the health and medical community here in the US to help the public make the connections between climate change and health. It's what we've been doing for a while, but it's clear that a lot more work needs to be done. And, I just, to take a moment, I mean, in the last 4 years, we have, as a public health community, advocated for the successful finalization of a number of rules. So there is a lot of reason for hope, and there's a lot of examples of things that we can point to that we did that and it makes a difference. I mean, over 50 years of the Clean Air Act, we've seen, dramatic reductions in air pollution and improvements in health. And yes, just in the last 4 years, we've seen tighter limits on mercury and air toxics from power plants, limits on carbon pollution from power plants, stronger cleaner cars and cleaner truck standards, an updated standard for particle pollution. I know this is like US specific, and I'll stop, but when we work together, we can get things done. We have held the line with the Trump administration before. And so I can talk more on that later if it's of interest, but we are, I think a lot more public education around climate change and health is an important part of that.
Diana, thank you for that. I think you answered the question I was about to ask, but your organization, Healthy Air Partners, right, within the ALA has been remarkably effective. Can you describe how it started and how you got that effective?
Well, I mean, it started over a decade ago, and I think it was after cap and trade failed, and there was a desire among the health community to start really talking about the health impacts of climate, because I think prior to that, it just, at least in the US circles, wasn't something that came up frequently. And I think one thing is we have really this coalition that the Lung Association leads really tries to do is to make it as easy as possible for a lot of these other organizations involved to join, because we know that the American Academy of Pediatricians and the American Medical Association, they have a lot of, and I know I'm getting too into the weeds probably for a cancer-focused panel, but they have a lot of issues they work on, and climate is just a small part of that. So I think making it as easy as possible for groups to join on, and giving them sort of an umbrella of defense, being like, you're not the only organization working on this. You're joining a community, and that seems to make it easier for folks, and certainly makes us more effective when we have more people at the table.
Fantastic. Thank you, Diana. I'm going to move over to a few questions that are in the chat, and I'm asking these out of order, so apologies to people who've put them in there, but the last question follows on nicely on the collaboration theme, so I'm going to start with that one. So Clara's written, collaboration is a strong theme. What would you say are the most impactful ways that cancer research charities can support oncologists and vice versa on making the links between climate change and cancer? I don't know if anyone in particular wants to take that one.
I can take a stab at it, and thanks for that question. I think the question is about how to, integrate climate change into our ongoing oncological research, right? And it could be in the area of, the more clinical aspects, but also healthcare and care delivery for, patients living with cancer. And even how to address the upstream drivers of climate and cancer. So that's kind of 3 buckets of research, and I'm sure there are more. And so I think those are some of the opportunities when it comes to linking cancer and climate in research. I think what I also would like to encourage, especially those who work on cancer research, that it's not about totally pivoting your research work towards climate. It's about finding ways to apply a climate lens into your existing, ongoing, and future cancer work. I get a lot of this question or related questions related to this from other specialties. Oh, should I be doing, for example, HIV research or tuberculosis research in a totally different way? No, it's actually about finding those connections. And I think now more and more research funders are also trying to look at ways or projects that include this, the climate dimension into the topic, but also in the design of the research. Because again, whether we like it or not, we will be continuing to fight cancer, but now in the context of a warming planet, and so we cannot anymore remove that from the equation.
Thanks, Renzo. Does anyone else want to come to that, or I'll ask the next question? Omar?
No, I think
it's fine. You took yourself off mute, so I was making an assumption. Okay, so we've got another question. This is for you, Omar, from Iman, who asks if you have reflections on the interaction of climate change with cancer care on the African continent, sort of overall, and maybe particular issues in that area. Iman, if you've got sort of specific things you want to add to that, do feel free to take your mic off and add in. But
yeah, thanks, Iman. That's an excellent question. So I think just following up on my prologue, the way I started off, the interactions between cancer care and climate change is a very hot off the press kind of high interest kind of topic. But it's the main Achilles heel, and the main problem is not many people actually know the intersection, or even, again, it's because of, as I mentioned, it's not in the curriculum, it's not getting a lot of representation in media. It's more intertwined to politics and a bit of conspiracy theories than actually real evidence from the science. So I think bringing it closer to the home continent is that the intersection really affects across the cancer care continuum, from early detection. Again, as I've mentioned, people are going farther away from hospitals and cities, and they're trapped in places with in search of water and pasture, again, because of long dry spell of weather patterns such as rain, people are really going farther and farther away from hospitals or access to facility, leading to late presentations, treatment interruptions. And the other thing also that is actually kind of unique to Africa is that, you'll be surprised there's less pollution. As Diana was saying from the American Lung Cancer Association, we know from the research that actually this only subtype of cancer that is highly correlated with environmental in terms of the climate change topic right now is lung cancer. Pollution, poor and environment in terms of the atmospheric, how clean it is and all that. There is an association of that with maybe some bit of on the background of lung cancer. But you come closer to Africa where there's less pollution and less burning of fossil fuels and industrialization and all this, you don't see a lot of disease that are directly correlated to climate change. But what you see is the aftermath and the domino effect of that, because now with late presentations, you see now patients really having poor outcomes, with high flooding, with high levels of flooding, and transportation network is getting cut off. Then you see late presentations. So it's more of a like indirect effects of climate change rather than direct correlation in terms of the pathology of actually the onset of these diseases. That's how I'm understanding. And I think that is actually, is a question that is tied at the hip of what Dr. Hamdi had asked, in terms of esophageal cancer, because of these high temperatures and high hot beverages, if there's correlation in that. I think these two questions can be separated. One is really more of the increasing incidence of esophageal cancer, especially in northern Kenya, in where I work, and the climate change. I think there might not be a direct correlation. A research was done on the temperature of hot beverages, and there was no per se a direct correlation on the causes of hot beverages to esophageal cancer. And the studies that actually needs to be done is a case control study where we compare head to head people who actually habitually taking hot tea to be randomized head-to-head comparison to people who actually have the disease but had no history. That's the only way to find out, honestly. But that said and done, the high incidence of esophageal cancer might not be directly correlated to climate change. And from my understanding, as I keep saying, the aftermath effects of climate change is more of indirect healthcare access, early detection, poor health-seeking behavior, deprioritization of even cancer care in terms of people, if you get hurricanes and high flooding, the last thing you're going to go is to go get a mammogram, right? Or get a low dose CT in search of maybe lung cancer, which is early onset. So I think it's about prioritization, and it's about really not forgetting the continent that least contributes to climate change is actually bearing the biggest brunt. That is the message that I really want people to get away from this webinar today, and that's Africa.
Yeah, absolutely. You're getting some applause in the from participants there. Venus, you got your hand up. Would you like to ask a question?
Yes. Good evening, good day, everyone. So I don't have a question per se, but I just want to follow up on the comments that have been made by the previous speaker. I just want to say, I don't know, I think also one of the challenges, I'm from Zimbabwe, one of the challenges we have in Africa is that absence of prospective studies where we have not in the past followed through people who have been exposed to the climate in Africa on their risks of developing cancer. So that data is very scarce. So I think that's one of the things where we cannot really conclude on the direct cause of climate change on climate change on cancer cases. But I also want to highlight the contribution of malnutrition in terms of looking at childhood mortality and how the children are actually faring with childhood cancer. You'd notice that most of the children are actually malnourished, and it's a result of droughts, flood, all those things that contribute from the climate change perspective, the decrease in biodiversity of the food that we eat, and all those. So I think it's something that we as in Africa, I think we need to study and look at the issue of prospective versus retrospective studies, so that we can actually ascertain the link between climate change and cancer. But I do believe there are cancers where there should be a direct link. Thank you.
Thank you, Venus. Yeah, really pertinent comments. And I think that highlighting that you're often tackling multiple issues all at the same time, aren't you, in these situations, and those, multiple health problems, but also those sort of wider determinants of health. And actually it brings me back to a question that I had before, which was, obviously cancer incidence and managing cancer are impacted also by a range of other sectors. And I wondered if anyone has reflections on how the health sector is best works with other non-health sectors in ensuring that we're protecting people's health in the context of climate change.
I can jump in. I think we need to use the power of our evidence, our voice, and our example. That's how we really strengthen our credibility when we talk to the other sectors. One, we cannot go to the other sectors like energy and transport, tell them to reduce their emissions, decarbonize, if we are not walking the walk and practicing what we are preaching. And so now healthcare systems are starting to think about how to reduce their environmental footprint. You may be aware that WHO has this global initiative called ATTACH, the Alliance for Transformative Action on Climate and Health. More than 80 countries said yes to building low carbon, but also climate resilient health systems. We need to make sure that these countries do succeed. And I think that, the cancer care community being deeply embedded in national healthcare systems, we do have an important role to play. And we can start within our own backyard. And I said the power of our evidence. We need to continue doing good research, right, on these issues. And I think I already mentioned, and I gave a sneak preview of what the research and action agenda might look like. The buckets that I mentioned, the different pathways that connect climate and cancer. And then, of course, the power of our voice and the role of advocacy. And, we need more, especially the younger oncologists who are listening here. We need to be going out. We need to be talking to our governments. We need to be, having conversations with the private sector and civil society, because it's your future and our future that is at stake. And we cannot anymore be mere bystanders and observers. We need to be in the arena.
Can I just add to that? I think we also need to, your point about education and the young folks is right on. And I think one of the sectors that we don't interact with and should is the educational sector. And that's everything from high school to college to oncologists and training. And I know one of the things that we've been trying to do is to get climate change more in the curriculum than it has been.
Yeah, just to add on to that, Sarah, if I may, the thing is, as Renzo mentioned, the carbon footprint really. I'm an oncologist, so I'll just speak on a typical day of a patient coming to cancer center, and think about it. The nurse that works, or the oncologist and the patient, they're all driving to the hospital with all that emissions and whatnot. If you think about it, they are hooked up to a one-time use IV set, which is thrown away right after that. Instead of actually, maybe thinking of other innovative ways, like maybe visiting a telehealth. COVID had shown us that actually making use of telehealth or telemedicine or virtual clinics actually really reduces the carbon footprint, and even the staff that really needs to come. So that staff has his own car, the patient has his own car, the doctor has his own car. The IV set that we're using is a one-time thing and we throw it away. You talk about so many things, like our sustainability integration knowledge is really poor. Our prescription is more circular than linear. It keeps on coming back, like patients are told to come back again tomorrow for a second dose, same thing. So there was a very nice paper. I'll just share it, the link on the Q&A box, talking about really how we can really, care for the planet the same way we care for cancer patients. And it gives a very nice, innovative ways of actually transforming cancer care landscape, and by extension, the healthcare services that we offer, by showing as an example, as Renzo said.
Thank you. Yeah, that's great. Thank you, Emma. And Ellie's just popped something in the chat from Columbia as well. Do you want to expand on that, Ellie?
Sure. I'm just very conscious that the point around education and the need to educate current and the next wave of current and future medics has been referenced quite a lot. And there is an amazing kind of piece of work being led out of the University of Columbia NYC, which is this global consortium for climate and health education. And they have, you can basically, universities around the world, medical schools and faculties can sign up to this network. And exactly to, I think it was Renzo's point earlier on, it's not about necessarily jamming more modules into very, very packed curriculums, but it's about providing materials to overlay the climate angle into current medical training. And actually through the Sustainable Markets Initiative Health Systems Task Force, which is chaired by AstraZeneca's CEO and is another public-private partnership, which is all looking at this decarbonisation piece. We have just supported the launch of a European network on climate and health, which is a kind of regional hub within Europe. And I know that there's further interest in expanding this kind of regional hub for best practice sharing, curriculum and content development in other parts of the world. So yeah, just wanted to flag that in the chat to say some work has already been done on this area, and I think it's going to be garnering a huge amount of attention and increased interest moving forward.
Yeah, fantastic. And I think there is work to put together a climate and health curriculum. Certainly, I know medical schools through the UK and in the US now have a planetary health scorecard ranking how well they're taught on these things, as a sort of introducing competition to the system as well, which I'm not sure is always a good thing. But yeah, lots happening in that area. I had a question for you, Elliot, coming back to public-private partnerships, which I know we've spoken about the benefits of that, and clearly some of the sort of power behind partnering with private companies. But I'd be interested in whether you meet resistance to that at all. And traditionally, in some circumstances, the private sector is seen as the sort of big bad. Not always the most easy relationship to have. And I wondered if you have thoughts on that.
Yeah, no, I think that can definitely be the reality of the space in which we operate in. I think there can be skepticism towards public, partnering with the private sector on things where commercial interests are perceived to kind of conflict with public health interests. I think one of the interesting things about the climate crisis is that, and the way in which it's impacting health and healthcare and business, is that it is actually in everyone's interest to step up and take action on things that will either help mitigate the impacts that we're having on the environment and adapt to the impacts that are being felt. So I've actually found, like through my experience of working in this space for a little while, this is one of the areas where we meet less resistance, because actually there's a huge kind of, yes, please, can the private sector step up and help catalyze action in this space? Please, can you help fill financing gaps? Please, can you bring expertise to these disease areas or these areas? And I think it's been quite inspiring to see some of the partnerships that are being catalyzed that may have started as, I don't know, joint initiatives to procure power for, to decarbonize the supply chain in one country, have now spun out, and you see private sector round the table with other bodies consulting on, climate and health adaptation plans and lending expertise in other areas. So I think a skepticism, of course, exists. In some cases, it rightly exists, and there should be things that are held more within the public domain and should be led by national healthcare authorities and politicians, absolutely. But where there is space for collaboration and input from the private sector, I think we've seen incredible results, and it's been really inspiring to see the momentum generating behind them. So I always say that, if you can kind of demonstrate action and impact in one area, then, move on and try and build on that momentum, that's probably the best way to go about it.
Thanks, Renzo.
Yep, very quickly. And well, we're still in the topic of partnership and collaboration, before we wrap up this session. I think one thing that we haven't really touched on yet, but it's very important and sadly oftentimes forgotten, is our partnerships with our patients and with our frontline communities and their families. And of course, families affected by cancer, they're already enduring, many hardships and challenges, but they also have an important voice, right, that be heard, and a contribution, right, to this movement, right? And because they're going to be affected by climate change, they are also already seeing the effects of climate change already. And so, in our when we build the strategy, right, of the cancer care community for tackling climate change, let's not forget our patients and our communities. Yeah,
that's a really vital point, and I think the patient perspective on climate is often overlooked. We think a lot about healthcare and health systems without thinking about the patients. Diana, I wondered, we've only got sort of 3 minutes left, but as an organisation that represents the health of sort of its population, do you have any sort of reflections on that?
I just really appreciate you bringing that up, Renzo. I mean, we work closely with patients. We represent patients with lung disease, and in terms of affecting change at the policy level, apart from directly helping patients, I think raising the voices of patients impacted by climate change has proven to make a huge difference when it comes to reaching decision makers too. So that's one way that patients can, that we really appreciate patient storytelling.
Thank you. Joan, I think this might be our final comment before we wrap up.
Sure. I was just going to say there was a question in the chat about what cancers are likely to increase because of climate change. And I wondered if Omar or Renzo wanted to address that.
Yeah, go ahead. I think we touched on that. The one that is probably really well known in terms of the evidence available because of the intersection between climate change and cancer is lung cancer. I see someone on the chat also talked about melanoma. Melanoma is quite common. Squamous cell carcinoma is as well common of the skin, the cutaneous, especially in down under in Australia, is quite really common, and maybe people up there, down there, really like to bask in the air, in the sun. But can I just talk about, instead of pinpointing one particular cancer, the general overarching effects of climate change on cancer? Really, it's about, it affects all the continuum of care, what we call early detection. If you have diverse and that like terrible weather climatic conditions, nobody will show up for even early screening. So let's start from there. And then diagnosis will be affected because of treatment interruption, because of, again, these natural forces, such as hurricanes or extreme heat or wildfires and all that. Treatment will also get interrupted, or even there will be very few people who will finish their treatment because of, again, such problems. Palliative care, fellowship and survivorship care, and follow-up clinic, all these will really be affected. But I think in terms of the cancer subtypes, those are probably the most common type of cancers. But again, it affects almost all. If you think of it indirectly, from food production to everything, it really cuts across. But I think the one that can really have direct correlation probably are those two.
Brilliant, thank you. Well, I think we're probably out of time, so thank you so much, everyone, for coming. Thank you to all the panelists for really fantastic insights and discussions. I think I'm taking away the collaboration and really bringing all sectors together on to work on this productively together in the face of all the other challenges that we have at the moment in different areas of the world. So thank you everybody for coming. There'll be a recording of this if you want to share it later on the London Global Cancer Week website. And we will hopefully see you again at
another event in the future.
Thank you.
Thank you all
Thank
very
you.
much.
Bye.
Thank you.
Bye-bye.
Bye. Bye.